All right, let's dive into this. Acute cardiorenal syndrome, CRS. Got a request to take a look at this. And when the heart and kidneys, well, they decide they don't like each other anymore, it seems like things can go south pretty quickly.
Yeah. No, absolutely. The consequences can be pretty devastating for sure. And you're right. It's not a case of one organ just giving up on its own. They're both talking to each other all the time. So if one starts to go, the other's usually not far behind.
Right, it's all connected. So we're looking at this medical review here, acute cardiorenal syndrome, an update. And wow, it's a lot to unpack. But just to give everyone a sense of how big of a deal this is, we're talking about a condition that affects millions of people worldwide. The article mentions that back in 2017, there were over 64 million people with heart failure,
Yeah.
and almost half of them didn't make it past 5 years.
And a lot of that's because of kidney problems.
Yeah.
Yeah, studies show there's a big overlap between chronic heart failure and chronic kidney disease.
Yeah.
They kind of go together.
It's a bit scary to think about, honestly. The review says that 18–25% of people with chronic heart failure, they also have chronic kidney disease.
Mm-hmm.
And then on the flip side, you've got 50% of people with severe CKD who also have cardiovascular disease.
It goes both ways, yeah. And that's why understanding this connection, this whole cardiorenal syndrome thing, is really important. It's like they get stuck in this vicious cycle where, like, one organ going downhill just makes the other one worse and worse.
Right. This is all starting to make sense now. So let's focus in on type 1 CRS, which I guess is the most common type, where acute heart failure is what triggers a rapid decline in kidney function.
Yeah, and it can hit pretty hard. So in the U.S., there are something like 1 million patients hospitalized with acute decompensated heart failure every year.
Wow.
And get this, 55% of those people end up developing acute kidney injury too.
Oh, wow.
Yeah. Type 1 CRS, it increases the risk of death within 28 days by a factor of 5.
Gosh.
And if you need dialysis on top of that, the risk doubles again. So it's pretty serious stuff.
So, okay, I'm starting to get how bad this can be. But how does it actually happen? Like, what's the mechanism behind this vicious cycle?
Well, it's kind of like a domino effect, starting with the heart, right? If it's not pumping efficiently, blood can start to back up, and you get this pressure buildup in the veins. Think of it like a traffic jam in your circulatory system.
Okay, that makes sense. And how does that pressure impact the kidneys?
Well, that pressure, it backs up into the veins that drain the kidneys. It's called renal venous congestion. It's basically like squeezing the kidneys, making it really hard for them to filter waste and do their job properly.
So it's not just about the blood flow to the kidneys, it's the pressure from the heart that's working against them.
Exactly. And then to add insult to injury, you can get fluid building up in the abdomen and around the kidneys, which puts even more pressure on them. It's not a good situation at all.
Yikes. But it's more than just those physical forces at play, right? The article also talks about these non-hemodynamic factors.
Right, you got it. It's not just about the plumbing. There are all these hormonal and inflammatory responses going on that make things even more complicated. For example, there's this system called the RAAS system, which normally helps regulate blood pressure. But during heart failure, it can go into overdrive, and that leads to even more fluid retention and stress on the kidneys.
So basically, the body tries to fix things and ends up making it worse.
Yeah, kinda. It's like a misfire.
Mm.
And then there's also this gut connection, which is pretty interesting. You see, when blood flow to the gut gets compromised because the heart isn't working well, it weakens the gut's barrier. And when that happens, you can have bacteria leaking out into the bloodstream, and that triggers this whole inflammatory cascade that damages both the heart and the kidneys.
Wow. So you've got pressure from the heart, hormonal issues, and then these inflammatory attacks all ganging up on the kidneys. And if that wasn't enough, there are even more risk factors that make some people more susceptible to type 1 CRS, right?
Oh yeah, absolutely. Things like diabetes, high blood pressure, if you already have CKD, even certain medications. And age is definitely a factor too. It's a pretty complex mix of things.
Okay, so now we have a pretty good understanding of what causes it and how it all works. But how do doctors actually go about diagnosing type 1 CRS? I mean, it seems like it could be tricky with so many things potentially involved.
Oh, it definitely is. It's one of those things where there's no one single test that can just tell you, yep, this is it. It requires a multi-pronged approach.
So the standard creatinine blood test, the one for kidney function, that's not enough.
Well, creatinine levels can be a little misleading in CRS patients. You see, diuretics, which are often used to treat heart failure, they can actually cause a temporary bump in creatinine levels, making it seem like the kidneys are getting worse, even when they might be getting better.
Oh, so you can't just rely on that one number.
Right, you got to look at the whole picture.
Hmm.
Symptoms, medical history, and then other diagnostic tools as well.
So what kinds of tools are we talking about? I know the review mentioned imaging, like ultrasound being useful.
Yeah, ultrasound is a really valuable tool. It lets doctors actually see the fluid buildup in different organs. The heart, lungs, liver, and of course the kidneys. It's like a window into what's happening.
So it's not just the snapshot of kidney function. It's actually showing the effects of CRS on all these different organs.
Exactly. And it's not just about seeing the fluid either. Ultrasound can also show how blood is flowing through the kidneys, which gives doctors a better idea of how bad the congestion is.
Wow, that's amazing. Are there other techniques used too?
Oh yeah, there are devices that can measure blood volume really precisely to see how much fluid overload there is, and there are even implantable sensors that can track the pressure inside the heart all the time, which gives you a lot of useful information.
It seems like technology is giving us a more and more detailed view of what's happening inside the body.
Absolutely. And the more
Man.
we understand, the better we can treat.
Well, speaking of treatment, let's talk about how doctors approach type 1 CRS. I'm guessing it's kind of a balancing act, trying to treat the heart failure without causing more damage to the kidneys.
You nailed it. It requires a very careful, targeted approach.
So where do they start? I remember the review mentioned diuretics as a first line of defense.
Yeah, diuretics are essential for getting rid of that excess fluid, but the key is in the dosage and how you give them. For a long time, doctors were kind of afraid to use high doses of diuretics, especially in people who already had some kidney issues. They worried it would make the kidneys worse.
But the review mentioned the study, the DOSI trial, which kind of changed the thinking on that.
Right, the dose trials showed that higher doses than what they were using before, they're actually safe and more effective a lot of the time,
Even for people with CKD.
even for people with CKD. Of course, you still have to monitor them closely, but it was a big deal for a lot of patients.
So it's about being more aggressive with the diuretics, but doing it safely.
Exactly. And then there's this technique called stepped diuretic titration, where they basically adjust the dose based on how much urine the patient is producing. It's kind of like a personalized approach to fluid management, finding that sweet spot where you're getting rid of as much fluid as possible without overloading the kidneys.
Okay, that makes a lot of sense.
Ah,
But what about those medications we talked about earlier, the RAAS inhibitors, the
yeah.
ones that help regulate blood pressure? Do they use those in treating CRS too?
Ah, those can be a little tricky in acute CRS. They're great for long-term heart and kidney protection, but in the short term, they can actually make kidney function a little worse.
So it's a bit of a trade-off.
Yeah, it's something that doctors have to weigh carefully. And then there's some newer medications that are showing a lot of promise, like the SGLT2 inhibitors, for example.
Yeah.
Those seem to be safe and effective even in acute heart failure. It's definitely an area where things are still developing and changing all the time.
Well, that's good to hear. But what happens when those diuretics just aren't cutting it? What's the last resort in really bad cases?
Well, that's when dialysis comes in. That's where you basically filter the blood externally and remove those waste products when the kidneys can't do it themselves.
But dialysis is a pretty serious intervention, right?
Yeah, it's not something you take lightly. And there's still a lot of debate about the best timing and the best type of dialysis to use for CRS. But the good news is that research is always moving forward. They're developing new devices all the time that could provide alternatives to traditional dialysis, and some of them are much less invasive.
So even though it's a serious condition, it sounds like there are a lot of promising things happening in terms of treatment.
Oh yeah, definitely. And it's important to remember that treating CRS isn't just about medication. It's a team effort. You've got cardiologists, nephrologists, nurses, pharmacists, and other specialists who all play a really important role.
So it's about more than just treating the individual organs. It's about understanding how they're all connected.
Exactly. And that's why communication and collaboration are so important. Each specialist brings their own expertise to the table, and that's what helps make sure the patient gets the best possible care.
It makes me wonder, are there actual programs or centers that specialize in CRS treatment?
Actually, yeah, there are. Some hospitals have these dedicated cardionephrology programs where the cardiologists and nephrologists actually work side by side specifically to care for CRS patients.
Wow, that sounds ideal.
Yeah, I think so too. And these programs, they often have access to all the latest technology, the newest treatments, and they might even be involved in clinical trials where they're testing out new approaches.
So it's something to look into if you or someone you know is diagnosed with CRS.
Absolutely. And, there's another important aspect of CRS that we haven't really talked about yet, And that's the psychological and emotional toll it can take on patients.
That's a really good point. It's easy to get caught up in the medical details and forget that there's a human being going through all this.
Right. I mean, imagine being told that two of your most important organs are failing. That's going to be scary and overwhelming.
Absolutely. And the treatments themselves can be pretty rough too. Diuretics can have side effects, dialysis can be really disruptive to your life, and just the fear that the condition could get worse, that can be really stressful.
Definitely. And that's why it's so important to make sure patients are getting emotional support and guidance as well as medical treatment. Things like support groups, counseling, and just having resources to help them cope with chronic illness. Those can make a huge difference in their overall well-being.
It's about treating the whole person, not just the disease.
Exactly. And that includes addressing the psychological and social challenges that go along with a diagnosis like CRS.
This has really been eye-opening. I had no idea how complex CRS was. It's not just a medical issue, it's a human issue, and it really requires a compassionate and holistic approach.
I couldn't agree more. And you know what? In the midst of all this, it's actually pretty inspiring to see how resilient people can be. People living with this condition and finding ways to live full and meaningful lives.
Their stories are amazing. We've covered a lot of ground today, going over the ins and outs of CRS, the latest treatments, and the importance of a holistic approach to care, but there's still more to discover.
For sure. In part two, we'll be diving into the research that's being done to try and find a cure for CRS. And we'll also be looking at the economic side of things because this is becoming a more and more common condition, and the costs associated with it are only going to go up.
It's definitely something to think about.
So join us next time as we continue to explore the world of acute cardiorenal syndrome.
So we're back talking about acute cardiorenal syndrome, and right before we took that break, we were getting into the idea of a holistic approach to treating this thing. Not just looking at the heart or the kidney separately, but really understanding how they both work together.
Right, exactly. And that holistic approach is not just about meds and devices either.
Yeah.
It also means thinking about lifestyle changes, diet, even the patient's mental well-being.
You were just starting to talk about those device-based therapies, and some of them sound pretty futuristic. Can we dig into those a little more? I'm especially interested in the ones that offer an alternative to diuretics or even dialysis.
Yeah, for sure. One that comes to mind is called the alpha pump DSR system. It's designed to pull that excess fluid out of the abdomen, which is a big problem for a lot of CRS patients. And it does it without having to rely on diuretics, which can sometimes be tough on the kidneys.
So it basically bypasses the kidneys completely.
Pretty much, yeah. They put a catheter in the abdomen to collect the fluid, and then it gets transferred to the bladder, and the body just gets rid of it naturally.
That's pretty amazing. What other kinds of devices are out there?
Well, there's one called the Reprieve cardiovascular system, and it's constantly monitoring how much urine the patient is producing and adjusting how much fluid is being removed. It's all about keeping things balanced.
So it's like a personalized internal fluid management system.
Yeah, it's pretty cool. And then there's the Precardia system, which uses a catheter to temporarily restrict blood flow to the kidneys. That helps reduce congestion and gives the kidneys a chance to kind of like reset and recover a bit.
Wow, it's incredible how they're using technology to tackle CRS from all these different angles. Are there any devices being developed that actually try to repair the damaged heart or kidney tissue?
That's a really hot area of research right now, actually. Scientists are looking into using stem cells to regenerate damaged tissues. And the idea is to basically restore function and undo the damage that CRS has caused. It's still early days, but the potential is huge.
It's almost like science fiction is becoming reality, but even with all these advancements, it seems like it would be really important to have a coordinated approach to care. The article stressed how important a multidisciplinary team is.
Oh, absolutely. CRS is a complicated condition, and it really requires expertise from all different areas: cardiologists, nephrologists, intensivists, nurses, pharmacists. They all have a crucial role to play.
It's about seeing the bigger picture, not just focusing on one organ or the other.
Exactly. And that's where communication and collaboration become so vital. Each specialist brings their own unique perspective to the table, and that helps make sure the patient gets the most well-rounded and effective care.
It makes you wonder, are there any specific programs or centers out there that just focus on treating CRS?
There are. Some hospitals have set up these specialized cardionephrology programs, and that's where you have the cardiologists and nephrologists working side by side, specifically to take care of CRS patients.
That seems like the ideal setup for dealing with something this complex.
I agree. It really does. And these programs, They often have access to the latest diagnostic tools and treatments, and they may even be participating in clinical trials, where they're testing out brand new approaches.
That makes a lot of sense. So if someone is diagnosed with CRS, it's probably a good idea to try and find one of these specialized centers.
Yeah, I think it's definitely something to consider. And there's another side to CRS that we haven't really touched on yet, and that's the emotional and psychological impact it can have on patients.
That's a really important point. It's easy to get so caught up in the medical stuff that we forget there's a person dealing with all of this.
Right. It can't be easy to hear that two of your most vital organs aren't working properly. That has to be incredibly scary and overwhelming.
Absolutely. And the treatments themselves can be pretty tough. Diuretics can have side effects. Dialysis can really turn your life upside down. And that constant worry that things could get worse, that can be really hard to deal with.
No doubt about it. And that's why it's crucial to make sure patients are getting emotional support and guidance along with their medical treatment. Support groups, counseling, having resources to help them cope with living with a chronic illness, those things can make a huge difference in their overall quality of life.
It really is about treating the whole person, not just the disease.
Exactly. And that means addressing the emotional and social challenges that come along with the diagnosis, like CRS.
This whole deep dive has been really eye-opening. I had no idea CRS was so complex. It's not just a medical issue, it's a human issue, and it requires compassion, understanding, and a truly holistic approach.
I wholeheartedly agree. And, in the middle of all this, it's actually really inspiring to see how resilient people can be. There are people living with this condition every day, and they're finding ways to live full, meaningful lives despite it all.
It's amazing. Well, we've definitely covered a lot of ground in this deep dive. We've talked about how CRS works, the latest treatments, and how important a holistic approach is to caring for patients. But there's still more to explore.
Definitely. In part 3, we're going to look at the research that's being done to try and find a cure for CRS. And we'll also talk about the economic side of things because as this condition becomes more common, the costs associated with treating it are only going to increase.
That's a sobering thought.
It is. But there's a lot of hope out there, too. So join us next time as we wrap up our exploration of acute cardiorenal syndrome.
Welcome back to our deep dive on acute cardiorenal syndrome. In the last couple of parts, we've gone over the connection between heart and kidneys, how tricky it can be to diagnose, and all the different treatment options that are out there. But like with a lot of complex medical conditions, there's always more to the story.
Absolutely. There's still a ton we don't know about CRS, and a lot of the research being done right now is focused on finding a way to actually cure it.
That makes sense. I mean, we've talked about ways to manage it and improve people's lives, but if we could actually stop it from happening in the first place, or even reverse the damage that's already been done, that would be incredible. So what are some of the most promising things researchers are working on right now?
Well, gene therapy is one area that has a lot of potential. The idea is to zero in on specific genes that play a role in how CRS develops, and then either fix those genes if they're not working right, or introduce new genes that can help with healing and regeneration.
Gene therapy, that sounds like something out of a sci-fi movie, like manipulating genes to cure diseases.
I know, right? It does sound futuristic, but it's actually becoming more and more realistic.
Yeah.
And it's not just gene therapy either. They're also looking at stem cell transplantation as a way to repair damaged heart and kidney tissue.
So you'd be using the body's own repair mechanisms to basically rebuild those organs.
Exactly. The idea is to introduce healthy stem cells into those areas where there's damage, and then those stem cells can turn into the specific types of cells that are needed to repair and regenerate the tissue.
That is wild. So with all this amazing research going on, is there any way to know how long it'll be before we have a cure? Are we talking years, decades?
It's tough to say for sure. Sometimes these medical breakthroughs seem to come out of nowhere, but research takes time. You have to do all the testing, the clinical trials, to make sure any new treatment is both safe and effective.
Right? You don't want to rush something out there before it's ready. But even if a cure isn't right around the corner, all those advancements we talked about earlier still offer a lot of hope for people with CRS.
Oh, definitely. And while all that research is going on, there are things we can be doing right now to improve the lives of people who are already living with CRS, raising awareness about the condition, supporting the research, and advocating for policies that help people get diagnosed early and have access to good quality care. Those are all super important.
You just reminded me of something we haven't really discussed yet, and that's the economic side of CRS. I mean, with people living longer and heart failure and kidney disease becoming more common, the cost of treating CRS has got to be going way up, right?
It's a huge concern, no doubt, both for individuals and for healthcare systems all over the world. The medications, the specialized procedures, the constant monitoring, and then the potential complications if things get worse, it all adds up.
It really underscores how important prevention and early intervention are. If we can figure out who's at risk and find ways to stop CRS from developing in the first place, or at least delay it, we could potentially save a lot of money, and a lot of suffering.
Absolutely. Things like public health initiatives that focus on heart and kidney health, encouraging people to live healthier lifestyles, managing blood pressure and diabetes well, and being careful about certain medications that can harm the kidneys, those things can make a big difference.
It's a good reminder that our health is something we need to take care of. Protecting our heart and our kidneys is an investment in our future.
Couldn't have said it better myself. And as we wrap up this deep dive into acute cardiorenal syndrome, I want to leave everyone with this thought. Knowledge is power. The more we learn about this condition, the better choices we can make for our own health, and the better we can advocate for ourselves and our loved ones.
That's so true. This deep dive has been a real journey. We've learned so much about the intricate connection between the heart and kidneys, the ups and downs of treating CRS, and the amazing research that's being done to find a cure. Thanks for joining us on the deep dive.